major emergency declaration. First of all, I want to sincerely thank every single South Australian for the extraordinary cooperation that we've had this week with what has been an extraordinary week. I know that many South Australians are absolutely delighted that as of midnight tonight there will be a lifting of the stay-at-home order, and I also know that many South Australians were absolutely delighted and relieved yesterday when we announced that people could get out for exercise within their family or household groups for up to 2 hours per day. But most people are very much looking forward to the easing of restrictions tonight. But my message to South Australia is very clear. We are not out of the woods yet. The expert health advice that we have received is that we are still managing a very dangerous cluster, and although we are reducing those restrictions, we are still very concerned about this cluster, and there are still many people that we need to identify and put into a quarantine situation pending testing results, and that needs to happen today, and all resources are being deployed to that very important task. Can I say what we asked people to do on Monday in response to the Parafield cluster was to go and get themselves tested. Some people had directions to go and get themselves tested, and I'm very happy to report that we've had 100% compliance with that. But we've also said to people we need them to go and get themselves tested, and we know that some people who have had symptoms, or some people that have wanted to go and get tested, have waited sometimes many hours in very difficult conditions to play their important part in helping us to get on top of this cluster. South Australians have responded in record numbers, and I'm very grateful for that. In fact, yesterday I can report that more than 19,000 tests were conducted. This is an extraordinary response, and for that I'm very grateful. And I can also say that we've looked at those results and we still have no examples of community transmission in South Australia. In fact, all of the cases that we have identified, we can trace back to their origin. So that is great news for South Australia. It certainly makes the work of Professor Nicola Spurrier much easier, knowing that we don't have widespread community transmission, that every single case can be traced back to its origin. I'd very much like to thank everybody that has been involved in a massive contact tracing operation this week. We have got an excellent team in South Australia that has been significantly expanded this week, but we've also had the very strong support from the Commonwealth Government, but also the teams in Western Australia, in New South Wales and Victoria. So we are very grateful to the Commonwealth, to New South Wales, Western Australia and Victoria for them being involved in this national operation to get on top of this Parafield cluster. I'm also very grateful to the Police Commissioner for acting very promptly to establish the taskforce, Taskforce Protect, headed by Assistant Commissioner Peter Harvey, who is going to look at all of the information that was provided as part of this cluster investigation by the Communicable Diseases Control Branch. It would seem that there are multiple issues for investigation, including who has provided false and misleading information to our Communicable Diseases Control Branch as part of their important contact tracing. I'm now going to ask Professor Nicola Spurrier to come forward and give us the daily update.
Thank you and good morning. So I do have one new case to tell people about today, but pleasingly this is not an example of community transmission of something that's just popped up out of the blue, but it's a close contact of a previous case, and because we got onto this outbreak very, very early, they were already in quarantine, and so they don't pose any risk at all to the community. He's been in quarantine since his partner tested positive. So it's definitely linked to the Parafield cluster. And as I indicated yesterday, we do expect to see more cases, but we are hoping that they will all be people in quarantine. And we are actually doing regular testing of people in quarantine. They get a daily symptom check, and we will be expecting to see that because of the incubation period, and it's about now that we expect to see those cases. So just in terms of some statistics, there's 26 cases now linked to the cluster. And good news, we only have one person in hospital. So the woman in her 80s has also been discharged along with her husband yesterday. And they are stable and they've gone into a Medi hotel again because they are still considered infectious. There have been now just over 5,400 close contacts or contacts of close contacts in quarantine directly linked to this cluster. So given that we haven't even had a week to have had that number of people identified and contacted and put into quarantine is a testament to the sort of hard work my team has been doing, the partnership with SAPOL, but also to the members of the South Australian public who have put up their hand and said, yes, that's me and I need to go into quarantine. So we still have some work to do, but just to say we have made huge inroads into the investigation and getting on top of this outbreak. Now, in terms of our testing stats, we have 37 active cases and a total of 554 total cases now in the state. But in terms of our testing stats, we have a really high level of testing here in South Australia. So over 19,000 tests in total yesterday. So if anyone's been keeping track of how many tests are done in very large states like Victoria, New South Wales, you'll appreciate what this number really means. Normally, you know, on a good day, we were getting 2,000 or 3,000 people tested. The labs have been able to crank up and get that turnaround of 19,000 tests. Now, people might think with so many tests in the system, what's our test time like, the turnaround time of testing? It's an average of 28 hours, so just over the 24 hours. But what I did want to stress is we have now got a system in place to absolutely focus on the people we're really keen on getting tested from our communicable disease perspective. And in fact, for that case, that I'm telling you about this morning, his test was back in 90 minutes. So for people that we have particular concerns about, we can prioritise that and we're getting those tests turnaround time very, very promptly. It is now the time of this outbreak that we will start to see in the next week anyone in the community who we haven't been able to identify through our extensive contact tracing who may start to become positive. So this is the time for all South Australians, regardless of where you are, to really think about the fact that you might be becoming unwell, you might be getting a little bit of a sore throat, runny nose and such like, and it will be this next week where it won't be that you've been told by CDCB to get tested or you think that you've been to one of the venues that we've listed, and that's a really big message for people today. This next week for us is critical in our state. Just to say that we do have considerable capacity, particularly at Victoria Park Racecourse Testing Station, for people if you need to get tested. So yes, it's the time for us to search for that general community transmission. A couple of other things I wanted to mention about our investigation to date. Whilst we have, over 5,000 contacts and contacts of close contacts in quarantine, there's about 40 close contacts who we haven't been able to get hold of directly. So everybody receives an SMS message to be told you're a close contact and you must go into quarantine and get tested. But of course, we want to follow that up and speak to people directly. There's about 40 that we haven't been able to get hold of, and that's a big push today. So we've got SAPOL helping us with that. Now, mostly those people will have got the message and they will be in quarantine, but we need to know for sure. And there's a few families from Roma Mitchell School. There's still people, obviously, from the Woodville Pizza Bar. Also, Flinders Uni School of English, if you happen to be a student there, there's a few of you that we haven't been able to get hold of directly. So if you're listening to me, if you could phone into our hotline. And there's a few people associated with Anglicare Brompton, not the workers, but that will be the contacts of the close contacts. So that's where we're up to. I also wanted to take this opportunity of just explaining a little bit more about our strategy in South Australia, and I know there's been quite a bit of media interest in that, and why have we done what we've done, and why have we done something different to what was done in Victoria and New South Wales and the like. So I thought first it's useful to go through this in terms of the timeline. So when we first got our first case, just recall that came out of the blue suddenly in the middle of the night on Saturday night last week. And the real reason we picked that up was not because somebody had classic COVID symptoms and came to the emergency department. It was because of our astute young junior doctor, who heard a bit of a cough and thought they'd take the swab. And that's where we started. The second part of this is that the contact tracing very quickly on Sunday was able to identify that it was linked to a Medi hotel. And subsequent to that, we did this huge blitz of testing in the Medi hotel. And that's how we picked up the additional cases at that Medi hotel. The other thing that I received very early on was information about the people's swab results. And what that showed was it was pretty early in the infection. And that meant that we had this very small window of opportunity. We were really early and we could get in early. And we also get serology results, and that's the antibody levels in people's blood that shows whereabouts they are. And there were very low, if no, antibody responses in that family cluster, which meant we were just at the early stages of this. So this is quite different to what had happened in Victoria and New South Wales, where things had actually evolved to quite an extent before they knew anything about it. But we had this opportunity here in South Australia to really nail it down. And then because of the blitz at the hotels, we then had this, on Tuesday, this other worker at a different hotel test positive. And the only reason why we picked up this case at the Stanford was because we had done our blitz testing on Monday, and we got that test back very, very quickly. The other thing that was obvious to me and also my clinical team was that the incubation period was very short, and we were seeing within 24 hours people able to infect other people, which meant that the generations would be very short, and we were seeing this generation of about 3 days between the first person infected to passing it on to the next generation of contacts. And it meant that we had to move very, very quickly. And as I said, we had this very small window of opportunity. We didn't sit on our hands. We got on and mobilised not only our own contact tracers, but we mobilised interstate contact tracers as well, because we really had to go fast. And of course, then we had this additional information that we could put the pieces together, that the Stanford case was linked to the pizza cluster. And of course, as you're all aware, our initial information was that this was somebody getting a pizza, and that meant that there were lots of other people in Adelaide who will have got pizzas from that pizza bar, and there was a long infectious time, about 10 days, that we were concerned about. So putting all of those pieces of information together is very complicated, but we had an opportunity here in SA to stamp this out and not go on and have community transmission that would mean longer term shutdowns and also potentially border controls from other states. So this is exactly why we did what we did. And so really, to be clear, the decision to lock down hard, and I know it's been very difficult for people in South Australia and perhaps difficult to understand, was not based on the interview with one man. We would never make those decisions in isolation with just one piece of information. It's very complex. And the other thing in public health, in fact in the Public Health Act, I have a set of principles, and the first one of those is the precautionary principle, and that's about acting swiftly without necessarily having all the information, because if you wait too long, you have missed that opportunity. And again, I was acting using that precautionary principle. So we didn't have a second chance to beat this wave, but we are really getting on top of it now, as you can see in terms of the numbers of people in quarantine. I just also wanted to stress that whilst I'm so pleased actually to see people out walking and exercising this morning, it really put a smile on my face as I came into work. And I'm really pleased that we can lift those harsh, that pause that we put in place as of midnight tonight. But it is very important that people who are in quarantine stay in quarantine. You still are at the highest risk, and you must stay in quarantine for that full 14 days. You also need to have a negative test result before you come out of quarantine, so that's very, very important. And for the rest of South Australians, this is the time that we may start to see any leakage in our, our attempt to keep this under control. So any South Australian who has any symptom at all needs to get tested. The other thing that you might be wondering about is, should we be wearing masks? And yes, masks are an easy thing to wear. It's not too much of an imposition, and it means that we are just dampening down any further risk of community transmission as we continue to do our work to contain this outbreak. We are not out of the woods yet. And I just want to thank all of the journalists in the room today who are wearing their masks, and a reminder that the mask does need to cover your mouth and nose to be effective. So that's where I've got to with my update, and I will pass over to the Police Commissioner because I know people are very interested in the investigational side of this outbreak. Thank you.
Okay, the investigation Taskforce Protect is still in its early stages. We have dedicated 20 experienced detectives to following up on the circumstances that arose from the people involved in the Woodville pizza shop. I can say that the person who is currently in quarantine and who was the primary person of interest is a 36-year-old man. He is lawfully in Australia on a temporary graduate's visa, which is due to expire in mid-December. I can't elaborate any further in relation to the circumstances. This is obviously now an ongoing investigation, but there will be regular updates as Assistant Commissioner Peter Harvey is able to provide them, and I would anticipate that will be sometime over the course of the weekend or at least on Monday.
Is the pizza bar under investigation for any other criminal activities or any of its associates?
Well, I can't elaborate on the matters that we are going to investigate, but obviously there is a spotlight that's been shown on the pizza bar now as a result of these circumstances. So we are interested in speaking to at least 2 other people who we believe can assist us with our inquiries, and my investigators will be making contact with those in due course.
Is that the owner of the pizza bar?
I won't elaborate. We simply are making contact with other people, at least 2, and as we have further information that we can provide, as the investigation progresses, we will provide that.
Can you say which country this gentleman is from?
I understand he's of Spanish origin.
Was he allowed to be working under that graduate visa?
I don't have the details in relation to what the requirements were for him to comply with the visa. We will have that at some point, but I just simply don't have it at this point in time.
Will you be aware of a lot of fairly wild speculation going around social media and being sent between people in South Australia and outside South Australia over the last 24 hours about this pizza bar? Would you care to quash any of them or give us some indication of what you want to talk to these people about?
I think the one thing that we can all appreciate is we don't control social media. We will investigate, we will collect information, and we will deal with facts, and we'll take a fair and objective approach to this. What people might choose to speculate is up to them, but we won't confirm that in any way at this point. We'll wait until we do have the correct information.
Commissioner, can we take it from the fact that this gentleman was on a visa, is any immigration issues forming part of the investigation and may go to potentially a motive about this person's conduct?
I can't speculate. All I can say is that my advice is he's lawfully in Australia on a temporary graduate's visa.
Yesterday you were very clear that had this individual not lied, as the Premier put it quite succinctly, that the state would not have gone into lockdown. Now, just following on from what Professor Spurrier said a minute ago, that seems to perhaps not be the case. Can you just clarify?
Well, we've had intensive conversations with Professor Spurrier and other members of her health team. It is fair to say that had this person been more upfront with us, we would not have instituted a 6-day lockdown. But as the Professor has explained, this is like the straw that broke the camel's back. This is the one element that pushed us from the level of restrictions we were implementing on Tuesday to a much harsher regime. So we were in a position to control community movement as a result of the growing concerns around the Parafield cluster. But this one element was what you would describe as that one last piece of the jigsaw puzzle that pushed us into a decision point that we had to make that choice to impose severe restrictions for a 6-day period.
The Premier said yesterday that...
Did you bring him in yesterday and have you had intensive questioning with him?
I won't elaborate on the progress of the investigation. I will leave that to Assistant Commissioner Harvey, and he will provide that in due course.
Commissioner, when does this individual's visa run out? Will this person be deported beyond that?
Well, my advice at this stage is that his visa is current until mid-December. Whatever occurs in relation to his status as a person in Australia will be subject to the outcome of our investigation process.
The Premier said yesterday that something about this man's story didn't add up. Do you think it was appropriate to go into the lockdown scenario on the basis of this testimony which had such question marks over it?
I think Professor Spurrier explained it really well, that the obligation on public health in dealing with a pandemic is to act quickly on the best information available at a point in time, and to wait until you have tied a ribbon around the package of information that you would rely on is in all likelihood leaving it too late to be effective in any actions you take. The concerns around the information provided by this individual arose as a result of a review of the circumstances and information that was at our disposal, and as a result of that, detectives went to speak to this person, which was when he made disclosures about the true circumstances. So I think the actions in the first instance were appropriate, and as Professor Spurrier has said, the contact tracing process is not as straightforward as people might expect it to be, and the need to act quickly is always there.
Did he live in the Woodville area? I mean, did it make sense?
I won't elaborate at this stage. I won't elaborate. We will provide as much information as we can as the investigation progresses, but I'm sure you can appreciate the process of investigating must take priority to providing little bits of information that might undermine the investigation process. Sorry?
Have the close contacts now been identified, and are they in isolation now that you have the correct information?
That's part of the process that's underway at the moment, is to identify all people associated with this particular individual who has tested positive, and also those people from the pizza bar cluster that may need to be followed up. We're doing that work.
Any additional people being...
I don't have that information at this point.
How many people in total are you looking for?
Well, at this point I don't have that information. This will be part of the interview process. This is the sort of information we'll be looking for, just how many people need to be identified and spoken to, and we'll work through that as quickly as possible.
So upon reflection, I guess there is a black and white thought process. A lot of people think that you did the right thing, but there's obviously a lot of people that think that you overreacted. Upon reflection overnight and in the last 24 hours, do you still firmly believe that this was not an overreaction, and every attempt was made to investigate this issue before we were placed into lockdown?
I'm confident, and we've reflected on this ourselves. I've spoken to Professor Spurrier, the Chief Executive of Health. I've spoken to my team. We've asked those very same questions of ourselves. We've tested the process that was applied, and both Professor Spurrier and I are satisfied that we made the right call at the time based on the information we had available. Hindsight's a wonderful thing. We don't have the benefit of hindsight at the time we're making these decisions. And it is not a black and white situation that we're dealing with. These are difficult decisions that have to be made, and they're made in the best interest of the wider community.
Commissioner, there are thousands of people that are in quarantine at the moment. Have you had anyone that has been absent when you've checked on them?
No, I get specific updates in relation to the compliance checking activity, and at this point I haven't had any advice of anybody who's been found to be in breach of the quarantine requirements, which I think is exceptional. You only have to look around the city to see, even at this point, after yesterday's announcements about the fact that we are releasing these heavy restrictions at midnight, people are still doing the right thing, and I think that's absolutely commendable of the community. It's one thing I was concerned about with the announcements yesterday, is that we would see people step away from the level of commitment they've shown us so far, but all of the indications are at the moment is everyone's still doing the right thing. We're very happy with that.
Commissioner, can I just ask you
Sorry.
Are there any concerns that this investigation into this gentleman could cause a climate of fear when talking to contact tracers, and people might withhold information?
I think Professor Spurrier highlighted that concern yesterday. We are taking a fair and objective approach to this. We don't go in with preconceived ideas from an investigative point of view. We collect information and we make assessments based on what we're able to collect. And we would certainly encourage anybody who is being spoken to by our contact tracers to be honest and upfront. It is a confidential interview between them and the contact tracer. That we are not interested in collecting information for police purposes. We simply want to know where people have been, who they've been in touch with, so we can actually instigate measures to prevent the spread of the virus. We are not looking to hand over information to police for what you might disclose. Just be truthful, and it'll help us help the community of South Australia.
Commissioner, can I ask you some rapid fire questions, please, about the directions? School sport and community sport?
Community sports can't commence at this point, but school sports can commence as of midnight. I'm not sure there'll be too many children out at midnight though.
Working from home?
Working from home is still encouraged, if possible. Where businesses are able to do so, we certainly encourage people for the next 8 to 10 days to continue working from home.
Construction?
Construction's able to commence as of midnight.
Dance classes and swimming classes?
Swimming classes, lap swimming is allowed. Recreational swimming at pools is not permitted under the current range of directions which will come into effect as of midnight. And dance classes, I believe, are to be considered like indoor fitness, so they'll be able to continue as of midnight.
And elective surgery?
Elective surgery recommences as of midnight tonight.
Sorry, Commissioner, could you just clarify there? Community sport, when will that be allowed to?
We are aiming for the 1st of December to remove the restrictions that come into effect as of midnight tonight, and we are hopeful that if we're able to successfully contain the current clusters that we're dealing with, and that there are no new events, that on the 1st of December we will return to where we were on the 15th of November, and we will also be able to open up the borders between South Australia and Victoria. Or South Australia will remove our border restrictions. We're yet to see what Victoria will do.
What's the difference between community sport and school sport?
Community sport involves a range of people coming from different community groups, different families, different vocations to participate in close contact activity, whereas school sports involve a very discrete group of children, usually, obviously, from 2 different schools, but all of those people are usually in close contact, and we can isolate them and identify them very quickly. Community sports is much more organic in terms of who participates.
Can I ask
How
Professor
many police
Spurrier?
officers now are in quarantine? We've seen that rise again today. How many are police?
My understanding is we've seen a dramatic reduction in the number of police officers who are in quarantine. They've been able to be released as a result of us pinning down the dates that are of concern in relation to exposure, and also the fact that they've been going through a testing process. So that's good news. We are seeing more police being released from quarantine.
Commissioner, you've seen a huge level of compliance and cooperation from South Australian residents, even when masks aren't mandatory, people are still wearing them. Do you worry that this, which many South Australians would deem as a stuff-up, that will erode their cooperation if there was to be another lockdown in a couple of months' time?
Well, let me be clear. I think the overwhelming majority of the community understand the difficult decisions that have to be made. Whether they choose to see it as a stuff-up is their prerogative, but I remain firm that the decision we took to go into a lockdown was the right decision on the basis of the information we were provided. We are hopeful that we don't have to go anywhere near this sort of scenario again, but if we are confronted with a set of circumstances that require difficult decisions, we'll assess those and we'll make the right decisions that are in the best interests of the wider community.
Just on that, one thing, Commissioner, just on that, do you think there's an unreasonable assumption that contact tracers have the same sort of skills as, say, detectives? I mean, they are health professionals asking these questions. They don't have the same level of, to be able to ask those questions like detectives would.
I think it's a similar but different skill set. As Professor Spurrier indicated yesterday, contact tracing is about building a level of confidence with individuals, obtaining as much information as possible. There is a relationship building process that goes into that. Detectives are probably more direct in their approach, and we are there for a different purpose. Our detectives are now supporting the contact tracing effort because we have so many people that we want to speak to. We have the ability to utilise other mechanisms to identify, locate and track down those people. And also we can support by interviewing them as well. And we would adapt our approach to be more consistent with the contact tracers.
With masks, Commissioner, should school children, when they return to school on Monday, wear masks? I'm not sure this is for you or Professor Spurrier. Should kids wear masks to school and teachers at school on from Monday?
It's probably one for the Professor, but I think it's been clear as well that we're encouraging people to wear masks in this current period of time. And we appreciate that it's difficult for children to wear masks, but those more mature children would be subject to the same request as others.
Does golf, does golf or water skiing count as exercise? I'm being asked to ask.
I would ask golfers and water skiers to wait until midnight and then go out and get stuck into it.
Professor, could we ask you a few questions? Professor, overnight there was another alert that was put out by SA Health about SA Structural. Could you talk us through that alert and also the timeline associated with that, with putting the workers there in quarantine, and why it has now been broadened?
Look, I'm very sorry I haven't got any further details, so people will just have to go and look at our website. But I will identify what more we can let people know about tomorrow for the press conference.
Professor, just on the cluster issue, the issue of surface contact, when the gentleman who we've been discussing was interviewed and you thought he'd had a takeaway pizza, presumably the alarm was around the surface contact of the pizza box or whatever. I think the Premier has previously said that the initial case in the Peppers Medi Hotel might have been from a surface contact as well, but were they the only two surface contact issues that weren't person to person in this cluster?
Yes, so definitely the cleaner. We're very concerned about how she may have acquired the infection. We know with some infection that's been acquired in similar situations in New Zealand, there has been definite fomite transmission or surface transmission, in as much as that's the only overlap that people can find in terms of being able to pick up the infection. There's been no other face-to-face contact. In terms of the pizza, it's now became, well, the second bit of information I was given was that in fact he had gone in and got the pizza, so he was in the bar for a 10-minute period, so there would have been some face-to-face contact, but now clearly this person actually works there, so it will obviously be more of that person-to-person contact, or an opportunity for that. I mean, just to say, with this question of how much does surface transmission count in terms of this particular virus, when you've got a lot of disease in the community and it's, you know, there's lots of case numbers, the majority of the transmission will be by droplet spread, so two people being close to each other. But when you have very few infections, any form of transmission is going to be important, and that's why in countries like Australia and New Zealand, we will have all seen cases of that. In countries such as, you know, Europe and the UK, they wouldn't be having the opportunity or even the time to be looking at that sort of transmission.
So if the first case in the Medi Hotel is the only case that is suspected of being transmitted by surface contact, is it actually possible that there was a quarantine breach in the Medi Hotel?
I'm not absolutely sure what you're getting at with the question, but all I can say is that we've had less than a week to get detailed interviews from huge numbers of people. We wouldn't have had the opportunity to go through minute by minute how someone may have got the infection. But what we do know is that this is and that's for all of our cases, what we do know is that it was a cleaner who was at back of house, and that appears to have been the first case in this whole cycle.
So I guess what he was probably asking is, is it still under investigation in terms of how this started in the first place? Is it possible that it wasn't contract?
Yeah. So definitely this, but it hasn't been my focus to be kind of looking at all of those details, because what we really are doing is getting at the front of this wave. Obviously, we want to go back in a real academic way and find out how this person became infected, because that's the way we'll improve our Medi hotels, not just for South Australia, but the whole of Australia, and indeed for New Zealand as well. And of course, I've been very lucky to have good relationships with people in New Zealand, and I know that they're looking to publish some of that information so everybody learns around the world, and it's important to get that out into peer-reviewed publications.
But are you concerned that there was a protocol breach? Are you still concerned that that could be the case?
I'm not quite sure what you mean by protocol breach. So we have an audit and we have oversight of all of the staff and CCTV footage. So we do know where staff are and what they're doing. But I haven't personally gone back to all of that data. From my perspective, what I want to know is how could it have happened, and how do we stop it happening again?
I think that's what we're trying to get at. So how did it get out of the Medi Hotel?
Yeah, so a bit early for that one. And when we find out, let me tell you, we will be aiming to publish that so it's widely known.
Professor, can I just clarify, please? Sorry, can I just clarify the time frame regarding the pizza worker? When did you find out, or when were you told on Monday night that there was concerns about transmission from a pizza box, and then when was the decision made the next morning to effectively recommend the state into lockdown?
Yeah, so on Tuesday night I get results emailed to me and a new case came through, and in fact during the day that was the case that I'd been told about in the Stanford Hotel. Now the case in the Stanford Hotel was really concerning, because it was either another breach in our Medi hotels or a transmission in our Medi hotels, or they were somehow related to the Peppers Hotel. But my staff hadn't been able to connect those two, and then I got this second case through late in the evening, and made contact with our communicable disease control branch, and they were saying actually this helps us make the link between the pizza bar, which I hadn't been aware of, and so I was told that this person was the delivery driver. And so therefore, and then told, of course, that this person had ordered a pizza. Now, subsequently, but not material at all to my decision making, was that I was then told he'd actually gone and got the pizza, which we've now subsequently found was not correct. However, what was in my mind was that we had transmission to a member of the public, not just a close contact, not just a work colleague, where you would expect, of course, if you're working in a hot pizza kitchen, that you could get transmission, but that someone was there for a very short period of time to pick up the pizza or have the pizza delivered. And if that was the case, we had 10 days when we had infectious staff working, and we had lots of people that could have come through that pizza bar.
So was it just considered a big coincidence that he also worked in a Medi hotel?
It is absolutely a coincidence. In fact, the only reason we knew about him was because we did blitz testing on Monday morning of all the staff in our Medi hotel. And it wasn't just security guards or our nursing staff or SAPOL, it was everybody we could find working in the Medi hotel. And we got that result back on Tuesday.
Professor, can I just to go back to the question, can you give us a precise time, please, about when you were aware or made aware of the pizza box, and then the decision to recommend the lockdown to the Commissioner of State?
So I can't tell you exact times. You know, I'm very busy and I've got lots of information coming to me, but we knew about the Stanford case and we told the press on Tuesday, and then later that evening, it was certainly after 8 or 9 o'clock at night when I'd got home, that I had received this other case, which I was told was the pizza delivery person. So it was regardless of I know people have got a bit, a thing about the pizza box, but it's the fact that this was a person who had either got a pizza from there or had got a pizza delivery, but they had only a short period of time of exposure to the pizza bar, and that meant that anybody else who had a short time of exposure in the same setting could have potentially contracted the virus.
So was there anything else that could have been done in the lead up to recommending into lockdown, or are you, upon reflection in the last 24 to 48 hours, are you confident that everything was done in SA Health's power to ascertain that this was potentially a concerning case of community transmission?
This was really concerning, but there were a large number of other things that I had information about, which I went through before. If this had been, a week later, it wouldn't have mattered because we would have already had seeding into our community. The fact was, this was so early at the beginning, way earlier than people clicked to things in Victoria, earlier than the Crossroad Hotel cluster and the subsequent seeding in New South Wales. I knew that we had an opportunity in South Australia to actually nip it right in the bud and avoid having any further cases of community transmission popping up. And as people know, other states have put their borders in place, and that has a huge impact on our economy and socially as well. And I'm also aware that those borders are unlikely to lift if we have ongoing community transmission. So there are a lot of things at stake here. So yes, that was the thing, as the police commissioner said, that was the thing that was the tip of the iceberg for me, finding out actually we have a really serious situation here if we can't get on top of it. So we've subsequently got further information, unfortunately, that this person didn't provide initially. And so we've had now a period of time where people have, a short period of time, where people have stayed at home. We've got all of our contact tracing in place. We've got interstate contacting in place. We have supercharged contact tracing, have quarantined a large number of people. So we haven't wasted time. Thank you, South Australia. When you were resting, we were working hard. And I am very delighted to be able to feel quite confident about lifting those restrictions tomorrow. However, we still have more restrictions in place for these next 8 days. This is the time to be wearing a mask, and if you get symptoms, to go and get tested, because if we did have any leakage, this is when we'll start to find out about it.
So the case overnight, I'll just go back to this, was the case overnight related to this new alert, SA Structural in Edinburgh?
No, as far as I'm concerned, as far as I'm aware, no. This is a person that was known to be a close contact, was already in quarantine, which is the whole purpose of what we've done here in South Australia. There was some concern about that person's workplace, and in fact, a call had been made to isolate a couple of co-workers, but we've called that down because there is no risk at all for transmission. But it wasn't in this particular venue that you're describing.
On Wednesday, when you were talking about the Stanford...
Why has that venue, Professor, why has that venue then been part of a new alert overnight that's the scope of it has increased?
Look, as I said, I don't have the information at hand to give you, but I'm very happy to find out and get back to you on that.
On Wednesday, when you talked about the Stanford case, you said that it crystallised to you a theory or a fear that this was a very fast-acting strain of this virus with a potential 24-hour or less transmission. Now that you know that that wasn't the case with that case, was there any other case where this was provable?
Oh yes, we've had very short transmission times with this particular virus, so this was not just the only instance. And we know that because of we know the precise time this came into the state, and the infectious period for our other cases, going from the traveller to the cleaner to the security guards and then to this large family group. I mean, we have extraordinary detail on how this has come into our state and where it's spread up until now, because we've been able to make all of those links.
Professor, can I just ask you please about...
Professor, sorry, one more question.
Professor, can I ask you about the Lyle McEwen doctor? Is she a hero that she...
I'd say a heroine. She's done a fantastic job. She's one of our junior doctors, but like I'd have to say, all of our staff in SA Health, they do a great job. She was on the ball. She knew what she had to do. You would have thought now we haven't had a case in South Australia for quite some time. Maybe don't bother testing people as much, but she knew what she had to do, and she heard this person cough a couple of times and thought they're not getting away without having a swab, and went ahead and swabbed it, so and swabbed the person. So that is, if we hadn't had that done, we would have found out about this in about 2 or 3 weeks, and we would have had widespread community transmission by now.
Can I also ask you, are there any other concerns about any of the other Medi-hotels not telling the truth to contact tracers? I don't know, such as any of the security guards or the cleaner? Has everyone been given full disclosures to your contact tracing team as far as you're aware?
Look, as far as I'm aware, I haven't been alerted to any other issues. Obviously, the for people involved with the Woodville Pizza Bar, that is a concern. But other than that, my contact tracers have not had any other alerts.
Premier?
Yes.
Sorry, we've just got one more.
When coffee's done, I'd like to ask the professor.
Yeah, we've just got one more.
Spurrier, thanks. 2 questions while I've got the chance. One, has it been ruled out that a cleaner didn't come in close contact with a COVID patient at the Peppers Hotel? They did not know a patient that was staying at the hotel?
My clear understanding is that they had nothing to do with the traveller at the hotel, but what I haven't been able to do is just go through all of the CCTV footage and such like. Of course, we're doing that investigation, but what my concern is getting everybody that's positive into quarantine so they're not spreading the disease.
And is there any point in the COVID Safe app? Is there any use for that at this point, or is that just past now?
Look, I think anything is useful. So if you've still got your COVID Safe app on your phone, keep it turned on. We will still use that information. We just haven't got widespread community transmission, and we haven't had since the app was introduced. So it hasn't become something that we've needed to use.
Professor, just before you mentioned that the doctor at Lyell McEwen and how quickly they acted and really nipped this in the bud. But I guess the issue around and the reason people keep asking around the quarantine at the Medi Hotel is if it takes a doctor acting in this way to stop this getting out into the community, don't we need to prioritise working out whether there's been some kind of failure at the Medi Hotel?
Look, we've already put in place improvements in our Medi Hotel system. We've already explained that we've had a national review and South Australia got a big gold star, and we were given a few small suggestions but nothing major in terms of improvements. But regardless of that, I could see that we were getting more and more positive people in our Medi hotels, and I told the media that I in fact followed a Qatar flight all the way through to people getting out off the bus and into the Medi Hotel, because I know that is our highest risk, and there are small things that we can do to improve that system. It is a very, very high risk situation, but at the moment, if I spent time going through that investigation, not to say that it's not important, I wouldn't be focusing on what I have to do now to prevent more infections in our state, and that would be the wrong thing for me to have my mind put to.
I think obviously the concern is there's been misinformation. The other one that we thought was the surface contact.
So no. I mean, from the no. There's no misinformation that would make any difference to the situation we're at the moment. So no, not at all.
Masks for children, Professor?
So masks for children are really for kids less than 12 can't wear a mask. Okay? You can't expect a 4-year-old to keep a mask on. That would be silly and inappropriate. Given that school is going back, we will be talking to the schools about risk mitigation strategies. There's certainly teachers that have chronic diseases and would be considered vulnerable. We want to make sure they're protected. But early on in this pandemic, the Education Department and the independent schools all worked with us on risk mitigation strategies, and they include having things such as staggered lunch breaks, reducing things in the schools such as whole of school assemblies, for example, and also making sure it's just a kiss and drop to have kids delivered at school. So we'll be working through those with the Education Department today.
A couple of questions for you, if you don't mind. First of all, are you considering any kind of business compensation package for the businesses who have lost inventory, have lost stock over this short shutdown?
My number one focus is just getting as many businesses stood up as quickly as possible, and that's why I'm absolutely delighted that as of midnight tonight, the vast majority of businesses that are affected will be back trading. There will be some restrictions right through to the 1st of December, but the number one priority is getting businesses stood up as quickly as possible. There are, of course, supports for employees and for employers, both with the job seeker and the job keeper for those people who qualify, and there's been generous support from the federal level and the state level, but my number one priority at this point in time is just getting businesses up and running again.
Premier, the question there was, will you be providing compensation? You've put a sledgehammer through the economy here in South Australia because of this lockdown, and people have lost thousands and thousands of dollars because of it.
And that's why our focus is getting business stood up as quickly as possible. Compensation is not something that we're contemplating at this point in time. What we're trying to do is to get through this situation, this very difficult situation, get back to the situation that we had prior to the paraffin cluster emerging, which was, I think, the best level of restrictions in the entire country. What we saw with the employment results, which came out on Thursday, was that in fact South Australia was doing so well that we had more people employed in October than we had back in January and February this year, and we want to get back to that situation as quickly as possible.
Premier, yesterday you said that you were fuming at this one man that essentially sparked Australia's harshest lockdown, but it was you and your government that made the decision to do this. Do you take responsibility for that, and do you owe the people of South Australia an apology?
Look, can I just say, right from day one, we've been really clear on the way that we're managing this pandemic, and that is to listen to the health experts and take immediate action, and that's exactly and precisely what we've done in this case. We've listened to the health experts, they presented us with information, we acted swiftly and decisively to keep the people of South Australia protected.
Premier, have you had some contacts? Will you let any of them sort of head in there today to prep for tomorrow? Will there be any leniency there?
No, look, we really need to be very strict on this issue. We are still in a stay-at-home order scenario through to midnight tonight. I don't want anybody watching this telecast to think that we are over the problems that we have in South Australia. Whilst the risk may be diminished and far more defined than what it was 24 hours ago, the risk still remains. It's a very real risk, and we need to adhere very strictly to the restrictions that have been put in place.
Premier, have you had any contact with your Victorian counterparts to say whether or not they intend to open borders to us on the 1st of December?
I did have some conversations with premiers and chief ministers yesterday. I sent messages to Dan Andrews and he replied to me, but we haven't had a chance to speak yet. But we are still on track to open our border with Victoria on the 1st of December.
Premier, yesterday you were pretty bullish about the gentleman from the Stamford. You called him a liar and you said you were fuming about what he'd done. Now the tenor today seems to be have calmed down a bit. Do you think you went a bit too hard on his role?
No, not at all. Providing false and misleading information to an investigation which involves a global pandemic is a very serious issue. We take it very seriously. There is an investigation underway, and quite frankly, I strongly believe that there have got to be consequences. We do not want to see this behaviour. When people provide incorrect information, when they provide that incorrect information, it sends us down a course of action which could potentially have lives at risk. So it's very important for people to understand that when they are interviewed by the Communicable Diseases Control Branch as part of a contact tracing exercise, that they must provide full information.
But you said yourself his story didn't add up. You didn't feel that there needed to be more questions asked about it?
Well, this is precisely what emerged, and the police, and I congratulate South Australia Police for the work that they did subsequent to us taking this action, which shortened the time that people will be in this this stay-at-home order.
Just on the heat today, obviously up to 37 degrees, usually people, they're conditioning the elderly might head to a shopping centre or some of those facilities where it can be full. Obviously they're shut today. What's your advice to them if they're stuck at home or if there's a blackout? Can they go anywhere?
Well,
exceptions, I suppose. Obviously, elderly aren't going to be exercising. You know, what can they do?
well, look, a lot of our most vulnerable South Australian citizens are contacted by government agencies during very hot conditions. I am also asking people to look out for family members and for neighbours, give them a call, see how they're going, and if there are any issues which need to be addressed, well, obviously the priority is looking after the health, safety and welfare. So written into the directions is an ability to care for somebody, and so I don't want anybody to think that if somebody is in danger that they can't be visited. That would be very counterproductive.
Premier, this hotspot overnight, SA Structural, is one of many businesses that have been forced to shut down because of mass quarantines. The whole staff, around 180, have been forced to quarantine, and they fear and have told us that they will be shutting down, or the business is now a complete threat of shutting down. What is your message to the business owner and for other businesses which have been forced to shut down during this period?
Well, if people are directed by the Communicable Diseases Control Branch to quarantine, there are supports available to them. In fact, $1,500 is available to them with a Commonwealth and state government package. So that's the first point that I would make. And secondly, if people are asked to take time off work to go and get themselves tested and they need to isolate before they get those results, then there's a $300 payment which is possible if, in both of those cases, people don't have access to sick leave. So I think we've got, we've learnt from some of the other experiences in other parts of the country and other parts of the world, where if you don't provide this type of compensation, people don't bring themselves forward for that testing or don't comply with that quarantine arrangement. We have learnt the lessons from what's occurred interstate and overseas, and we've put this plan in place in South Australia.
Premier, just lastly, do you accept that there has been a shortcoming in the hotel quarantine system here?
Not at all. There will be a thorough investigation, but what we've said right from day one is this is a highly contagious disease. We know that. We know that very senior trained nurses have come into contact with this disease, and even with all of their PPE have been able to contract that disease. So we know that there is a risk associated with every time we bring somebody into this country, but we do believe that we have an obligation to play our part in this national repatriation of Australian citizens.
And could you just give your comment on this? We've just heard per capita yesterday, we've just had the highest testing of any state, 674 per 100,000, bigger than Victoria, bigger than New South Wales. What's your response? You must be happy.
Yeah, look, I'm absolutely delighted with the way that the South Australian public have cooperated with SA Health to get record testing done in South Australia. And this has given Professor Nicola Spurrier huge confidence that we don't have widespread community transmission in South Australia. But the issues with regards to this cluster are not over. So anybody with even the mildest symptoms needs to go and get themselves tested. This week we have massively expanded the capacity. I think we all remember the lineups that existed on Monday, Tuesday and Wednesday. Yesterday and certainly today, we know that those clinics are moving through very, very quickly, and those tests are being taken, and most importantly, the turnaround for the results is very good. So please, to anybody who has any symptoms, go and get yourself tested. We are not out of the woods yet.
Thanks, everyone.
Thank you.
Thank you.